you would have just completed your first full week of classes, and for many of you in third year, of course, it was your first opportunity to be on campus. So again, I'd like to take this opportunity to welcome you. Also to those students who are in our grad program and the nurse practitioner students who have arrived on campus, again, welcome to the University of Saskatchewan. When I was meeting with the first year students at SciAS and also with the third year students here during orientation week, there were some messages that I had shared with you that I've had some feedback from students that you'd like to actually have the quotes that I used or have me talk about it a little bit in more detail. And those issues really were around leadership. And so I do think that it is a good opportunity for us to have that conversation as you enter into a profession where, in fact, you will be in a position of great trust by patients and families, and also there will be an expectation for you to be a leader as an individual student and as a graduate of the program in fourth year going into the nursing profession. So the first thing I'll talk about a little bit, which I did share with the class in first year, was about trust. And oftentimes we think that trust is a character trait. It's something that people think about us. But it isn't just that. It isn't just about who you are as a person, whether you're good or sincere. Trust is really a function of two different things. One of them is, of course, your character, but the other is your competency. And I found this definition actually from a book I was reading by Stephen Covey, which really talks about the speed of trust. And what he said is that character is about your integrity and how you behave with other people. So how you interact with your patients, how you touch them, how you look at them, how you converse with them. But also it's a factor of competency. And competency really is your ability, the skills that you use, and the results that you achieve. It's about your track record. So what do patients think about you when you walk out of the room? What are the ways in which they talk about who you are, how you provided care for them, and whether or not they felt the sincerity that you were bringing into that interaction. So it's also about what you do. And over the next 2 years, for those of you who are in third year, you will have your professors help you to develop those competencies and to reach down into your own character and figure out what it is that you want to do as a nurse. Also, of course, in the grad program, our students have already experienced what it means to be trusted by patients and families. With the third year group, I shared a quote that, again, I think is something that many of you over the third and fourth year, and particularly those of you in the grad program, really need to think about. And that quote was about leadership. And it was written in terms of the business world by Keith Grint. And what he said was that leadership is the property and the consequences of a community, rather than the property and consequence of an individual leader. So that means that who you are as an individual, in conjunction with your peers, with your professional community, that's what constitutes leadership. So it isn't just about who you are and what you do, but it is about the way in which your community supports and takes a leaderful approach in terms of nursing. And your community is your class, the college, and the nursing profession in general. So I want to leave you with those two things to think about: leadership and how you bring your community into a leadership position, how you function within your community as a leader, and about who you are in terms of our ability to trust you with our future, with the college's image, and your patients' interest in you as a person with character and a person who is competent. So I do hope that you enjoy the year within the College of Nursing, and I look forward to meeting all of you. Congratulations, and I wish you well for the year.